Hey everyone, Chris Lewis from Fox 47's Digital Newsroom. Thanks so much for being here today. Today we're learning a little more about healthcare in this crazy time that we're in and how different healthcare teams are acting to help other parts of healthcare. So I'm really excited to be able to have Dr. Shingles on with us today, Dr. Michael Shingles. He's with MSU Sports Medicine, and he is going to be talking to us a little bit about what they're doing to be able to try and work to decompress some of the emergency room traffic so that the emergency rooms can focus on what they need to be doing, which is focusing on those with COVID right now. Dr. Shingles, thanks so much for being with us today.
Thank you for having me.
I really appreciate you being here and talking to us today. Now, as I said, when we were first starting, I know that your clinic is working to try to offset some of the patients that would typically be going to an emergency room. Tell me a little bit about that and what caused you to decide to move in that direction.
We're trying to deal with the pandemic and how it affects our society, and in our role as orthopedic surgeons and sports medicine docs. There's emergency orthopedics. We take orthopedic call at the hospitals, and when things come in that have to go right away, if they're limb threatening, if they're life threatening, those are pretty easy. Those type of surgeries still go on. But then there's everybody else. We take care of a lot of patients. We're busy practitioners. We take care of athletes. We take care of, patients of all ages. They're dealing with difficulty getting around, moving, doing activities of daily living, being active. And the big shock to all of us was, well, we need to shut things down, and there's reasons for this, but we can't take care of those people anymore, at least at first. They're no longer priority. Priority is preparing for the COVID patients and trying to keep the numbers down so we can learn more about this virus. And every day that we keep the numbers down, we learn more about the virus and learn more techniques to treat the virus. So the ultimate goal here, by keeping not only us, but all of us at home, is to buy some time. And this time is very valuable, and we're gaining a lot of information, and this will help us treat this and get our lives back to a more normal sense. So for us at Sports Medicine Orthopedics, we still have patients that need help. They're still at home and they're having pain. They're worried now that they don't want to go to the hospitals. They don't want to go out because they're being told they're not to, and they don't want to catch this virus. And so what all the orthopedic surgeons in the community, and including our group, we had a discussion with MSU Health Care and the sports medicine program and orthopedic surgeons here at the university, along with our private practice partners in the community. We got together as a community and found out, well, what can we do? How can we help out during this time? It's been a while since I've worked a ventilator, and my comfort zone for that's not quite there at this point. But how can we help our colleagues at the hospital in fighting this battle? And the overall consensus was, with the hospitals, if we could decrease the flow of non-essential injuries to the hospital, the ankle sprains, the injuries, some things that can be treated outside the hospital, if we keep them away from the ER, that frees the ERs up to allow for patients dealing with this COVID virus. And as we get to what they call the surge, where these numbers are going to be greater in our community, that'll prepare them for it. And so both hospitals were on board with if we could decompress that. And so our group, along with some of the other orthopedic groups in town, our goal would be to try and provide a service that's safe for our patients, safe for the community, safe for our staff, and then, of course, the providers. How can we help with this process? And what we've determined is we've started up, I'll call it an urgent care. Really, it's just access for patients with musculoskeletal problems, where they can call our office and we will triage it. We'll figure out how to help take care of those patients. Now, that could be you need to come in and we need to get an x-ray. That could be you need to go to the ER because this is more serious and we need ER and hospital facilities to take care of you. Or it could be, hey, I'm going to get you hooked up via a telemed conference, sort of like this interviewing is being done. And we'll be able to talk to you on that and triage your problem and walk you through it and talk about a plan and determine whether you need to come in. And if you do, move from that. We started doing this. The healthcare at the university jumped all over this, and it got us access to telemed. And we've been working on this for the last week, and it's been great. I can talk to my patients. I can go over where they at with their rehabs. I can talk to them about new injuries. and I can reassure them. And what we're finding is people are just nervous. They're just scared. They don't want to leave the house, but they're dealing with a lot of stuff at the house. And so I think it's helpful for them. And frankly, it's helpful for me to be able to communicate to them and tell them, like, hey, it's not a big deal. We're going to get through this. This is secondary. This is what you need to do in the meantime. This is what the update is. It's been very, very helpful for our patients and certainly for us to feel like we're contributing to this process.
So if someone is feeling like they have a sports injury or a injury that would typically come to your clinic, what is the first step? I mean, should they be contacting 911 if they fall? Should they be going and contacting the hospital to say, should I come in there? Should they call your office first? What is kind of the first step for someone?
Well, I think right now people have dealt with injuries, and if it seems minor, doing the ice and elevating it and see how it does over a couple of days is certainly reasonable. By shutting down sports nationwide, by shutting down the ability to go out and do things, there's been a lot less emergencies. So that's one good thing. But people are working around the house and they're getting hurt, and say you fall down the stairs and you can't put weight on your ankle. Well, the concern is it broken? And if it is broken, what's the best thing to do about it? So first of all, you have to assess your community. Where are we at? What are we doing at this point? Is it reasonable to go to the hospital? And the answer is probably not right now. That's not what the hospitals are set up for. They're preparing for, again, the COVID numbers and the surge. Whether it's local urgent cares and you feel comfortable going to that, or it's calling your established doctor, or in our case, what we're offering is you can call MSU Sports Medicine and you can say, I have an injury. And then that will be triaged by a doc. One of our docs in the office will get the note from whoever answers the phone. Hey, what should we do with this? And what we're going to try and do is get people in that day, or certainly by the next day, with either come in and see us, or, hey, we're going to telemed. You're going to tell me what's going on. We're going to figure out what's going on. We're going to make an educated decision. Maybe it's come and get an x-ray, and we can still telemed with you. Maybe it's come and get a boot. Maybe it's come and you just need to be seen. The one thing is the volume is significantly down at this point in time, so we can provide a safe environment for our patients to come in and be seen, meaning the waiting rooms aren't as crowded. We are asking that if you come in, if you can't walk, you might not be able to drive, but you bring one person with you, not a whole family. That cuts down on exposure. You'll be asked to wear a mask for everyone's safe. We'll be wearing a mask for everyone's safety. I think that's going to become a reality in the United States here. We have to realize that if you wear a mask and the person across you wearing a mask, and you both wash your hands, your chance of getting COVID has dropped substantially. It's almost as good as quarantine. And that's just not something we're used to. We're used to shaking hands and giving hugs and not wearing masks, and that's just our culture. And that'll be a little bit of a hard turn, but that's going to be the first step to getting us back to normal. And we're certainly in the hospitals already doing that. You're going to be wearing a mask and you're going to be protecting yourself. You got to be careful because these masks they are running out, and we need those for our colleagues on the front lines. But you've seen plenty of videos and good recommendations. Cloth masks do not work as well as regular masks, but they still work a lot better than not wearing anything, and that's the recommendations right now. And so we'll have the utmost safety in the clinic for our patients that come in. But just in general, the guidelines we're going to ask you to do are the same guidelines that you should be doing anyway to protect yourself. And this is just a very safe way to get your ankle sprain or your wrist sprain, or what we want to rule out is that you didn't break something.
Now, I know that some individuals are living with pain and they've been waiting for surgeries to happen. And right now, a lot of those surgeries are being considered as elective and are not allowed based on that. So what are you doing with those patients?
The wording is essential versus non-essential cases. And essential cases right now are cases that have to go. Obviously, the most essential cases are life-threatening or limb-threatening. And certainly we're doing those procedures now. Our guidelines currently in Lansing, as of today, are if the surgery being delayed a couple weeks is going to negatively affect the patient. So that includes a lot of fracture work. Fractures start healing after 2 weeks, and so if you don't get to them early, it can cause problems. Obviously, there's orthopedic, what we call orthopedic emergencies, which are cases that have to go immediately, or they can cause immediate problems long term. Then there's everybody else, which is the majority of surgeries that we do. There's anything from truly elective cases where this is sort of bothering me and I really want to have something done with it, but maybe we'll do it after golf season. Well, that would be an elective. That would be a non-essential case, of course. It's not important enough to get done right away. You're hurting, but in those cases, it can be backed up a little bit. But then there's sports injuries. So tore my ACL, I can't get back to sports. Unfortunately, those have been temporarily blocked. And that's frustrating because you got a lot of people sitting at home and they'd like to be recovering. But the problem is twofold. We don't have, if everybody does that and we treat all the patients we want to, we really are, we do have, it's better than it was, but we still have a shortage on protective PPE, protective wear for physicians and equipment. And so we're utilizing those resources. Plus, to be frank, we're learning more about the virus. So we want to make sure when we're operating on people, and being in the operating room is a sterile environment, it's very clean, but we want to make sure that the patient's safe, other patients in the hospital are safe, and then the doctors are safe and the staff's safe. So as we learn a better system, we will be operating during this period on elective cases because we're going to have COVID virus around for a while. It's just hopefully we're going to understand it a lot better and be able to get policy that will allow us to safely treat patients. So the question is, well, when will that happen? I'm actually on one of the committees at one of the hospitals in town that we're looking at. All right, well, first of all, the governor's got to say you can do the non-essential cases. Then we have to figure out what's the safest way to take care of our patients. And that probably will involve some kind of testing of the faculty and staff working at the facility. Certainly the everyday sterilization that we do anyway at the operating room, and maybe some stricter guidelines that from the step time you walk into the hospital to the time you leave, you're wearing a mask. Everyone wears a mask. And then some logistical stuff. How do we make sure going from one patient to the next patient, we've avoided any sign of a potential virus threat? So there'll probably be some kind of actual testing for elective patients once we have better testing and it's more, and the turnaround's better and it's as accurate as possible. So potentially we may have, you get tested the day before or a couple days before, and then you are allowed to have elective surgery. Or if you test positive, we determine how long it's been since you've had the virus. So those are the things that we'll be working out in the, behind the scenes for when we can start taking care of, that total knee replacement that you're looking for, or the meniscal tear that's bothering you. Everybody can sort of deal with that for a little bit. And as a society, we're asking everybody to sort of do their best with this and try not to let it stress them out more. Because there will be a time when we can get this fixed. And that time will be more, I think, dependent on getting a process to make it safe and making sure that we have those resources available for those procedures. So it may get a little worse before it gets better, but ultimately I see that probably within the next couple months.
Now, if anybody wants to find out more about your clinic or how to access your clinic, where should they go?
You can call MSU Sports Medicine at 517-884-6100, and then you'll talk to, again, one of our staff. It's going to be, phones are from 8 to 5 regular hours. If we feel that we need to extend that or go into the weekends down the road, if it's necessary, we'll do that. But for now, that will be the hours. And then you can also go to MSU Sports Medicine online, and there's information there as well.